let me say, unjustified war on Ukraine tragically provoked an anti-refugee crisis, forcing many Ukrainians to flee to neighboring countries as well as countries in other regions of the world. I would like to ask you first, what are some of the lessons learned in managing the refugee crisis? And also, what would you say are some of the do's and don'ts of managing mass migration in a humanitarian way that takes into account chronic health needs, including, of course, in relation to HIV?
Thank you. Buenos dias. I came here directly from Kiev, the city which was so heavily attacked as many other cities in Ukraine yesterday, with attacking civilian sectors, kindergartens, apartment buildings, playgrounds, and many more. Not only in Kiev, but in many cities all over Ukraine. This is an example how fast-track city is reacting to extraordinary circumstances. Could you imagine that everything you planned in a normal life, just in a moment, turned upside down with the war coming to your country? It's terrible, but this is an illustration how we can sustain even in extraordinary circumstances. I'm here bringing our national flag as a symbol of resilience and fighting, not only for Ukrainian territorial integrity, but for human rights, for civilized principle of coexistence, fighting for all of us. Fast-track cities were affected the most from the very beginning, from 24th of February when Russia invaded Ukraine and started bombing all major cities. Our lessons are that mayors play a key role being on the front line with people. We see our president addressing the nation every day from the start of the war. We see our mayors, Andriy Klepikov, Gennady Trukhanov, Boris Filatov, Alexander Vilkov, also being with people, with the city dwellers, also every day being in daily contacts. It's critically important to demonstrate leadership in these extraordinary circumstances. Another lesson is partnership. In the situation of war, something doesn't work. And we see the situation when a pharmaceutical plant producing methadone was destroyed. So government couldn't easily procure medicines. We did. By we, I mean civil society organizations, like Alliance for Public Health organization, Network 100% Life. When it comes to the delivery, procurement of medicines, international organizations came, like PEPFAR, Global Fund, WHO, UNAIDS, and helped to procure. When it came to the delivery, again, civil society stepped in. It's very important to rely on each other in these extraordinary circumstances. And I'm happy to say that in addition to municipalities, to the government, civil society and community is also backbone of the HIV and TB response. The investments done in these sectors paid off a lot. Talking about migrants, we have both internally displaced people and migrants. Since the World War II, it's the largest move of the population in Europe. We have 7.1 million internally displaced people, 7.1 million, and 6 million war refugees or migrants. So 13.1 million Ukrainians moved, and moved sometimes in half an hour back in their backpack and just escaping from the war, not prepared absolutely. So even those who appeared in other cities, they're also moving back, returning, and so it's very dynamic process. So in this situation, also combination of civil society support is critical. When we reconnected with the patients from Mariupol, the city also signed various declarations, and where 90% of the buildings were destroyed, same as Aleppo in Syria. Patients contacted firstly not medical doctors, but social workers. The people they have the largest and more significant trust with. So a few lessons then. So one is having mobile services. When your population is mobile, your services cannot be static. So we use mobile clinics, we use them in the occupied territories and the situations where hospitals are destroyed, still providing life essential services to people, including IDPs, internally displaced people, and migrants. Second, go digital. People use their phones to track the situations and use the same for medical services. We serve over 11,000 migrants in other countries, even in developed countries like Germany or Hungary, but people don't have access to services because of the barriers, because of the lack of documentation, registration, language barriers. So these applications like Help Now was critical to continue treatment. And another thing very important is to rely on civil society and community, because as I said, this proved to be reliable and effective mechanism in the wartime, in the time where usual connections collapsed. Finally, I would like to say everyone who supported and keep supporting Ukraine in this situation. We are displaying the QR code for further support because we are receiving more and more requests from cities, and we are also helping and looking to help because of the upcoming winter. Winterization is critical. When we talk about human rights, it's also important that even fundamental rights like right to live, right to eat, right to not to be frozen are under threat. So in order to address this, we need more funds to address humanitarian needs. We used to work in HIV areas, but if someone is asking for bread, I cannot say, sorry, I have only condom for you. Yeah? We need to find a way to provide bread to those who are hungry. So that's why resources are critically needed to address humanitarian needs, to address needs to prepare for the winter. We will have a special session later at the conference on Thursday 13 from 9 to 11. It will be a satellite session. And for now, I really would like to thank you. Together we will win. Glory to Ukraine.